Started.
Okay, awesome. All right. Good afternoon, everyone. Welcome. You are joining us for the Firefighter Cancer Initiative's seminar series. We'll give a few minutes for the room to populate, so please take some time to adjust audio, and we'll get started just a minute or two after the start to allow some folks who are trickling in to settle in. Okay, welcome everybody. Make yourself comfortable. We'll get started in a minute or two. If you're here, you're at the FCI's monthly seminar series. Okay, everyone, we're going to do one more minute, and then Dr. Solle and I will get started. Okay, it's 1:03. Why don't we go ahead and get started in the interest of time? I want to welcome all of you that are here in our online digital home. It is our monthly Firefighter Cancer Initiative seminar series, and it's a special one because we're kicking off the 11th year of the Firefighter Cancer Initiative, which is hard to believe that it's already been 11 years. Our plan for today is that Dr. Solle and I would like to walk you through, as we reflect back on year 10, what we did in its progress and what we see as sort of next steps for it. We want to remind you that you're always welcome to ask questions or give comments right here in the chat room's Q&A, so please feel free to populate them. And let us know your thoughts and your questions. We'll grab them over at the tail end as we do them together. Dr. Solle, any words before we get started here?
No, thank you guys for being here. We're really excited to share with you, some of the really exciting work that we did in year 10. It's always great to look back on a year and see all that's been accomplished by our amazing staff and team and, scientists at all levels, from students to full professors. So we're excited to share with you a little glimpse into year 10.
Okay, so kicking it off, we want to share with you the video that was produced primarily for Symposium, but really does a great job at highlighting in a very brief minute the work of FCI. So hopefully you'll be able to hear our sound as we share with you a video relapse of what we accomplished in year 10.
We're here to recognize the tremendous effort of the Firefighter Cancer Initiative.
A decade of being an agent of change.
We started in 2015. It's to study the cancer risks in the fire service and how to mitigate those risks.
A decade of helping save lives.
The research, the studies that we've been a part of, all point to that firefighters have certain cancers elevated in the general population.
Putting it on par with smoking and obesity as an independent contributor to cancer risk and outcome.
We're delighted to have you with us to participate and share in the inaugural 2019 National Firefighter Cancer Symposium.
6 national symposiums informing and educating with the latest research. starting with 300 attendees in 2019 and growing to more than 1,300 last year.
10 years ago, we would never have had this conference. 5 years ago, no one would come to it. And now look around you. Everybody is talking about cancer in the fire service.
I do have breast cancer right now. This is completely has to be for my job. I'm just lucky that I went and got checked. You just have to protect yourself and make sure you wear all your PPE. That's why we're here, for prevention.
75 peer-reviewed publications, 253 presentations made among academics and our community. Participation goes beyond 48 counties in Florida. The FCI is a partnership among all 50 states, the Caribbean, Europe, Australia, and South America, educating more than 13,000 firefighters, leading to change in processes and policy that have reshaped health protection for these first responders, reducing risk exposure through decontamination of gear and of cabs, a process that, in collaboration with policymakers, is now state statute.
With research, with best practices, with interventions, we're learning together and sharing how to prevent firefighter cancer, certainly try to mitigate the exposure to the many carcinogens that you find at an emergency scene of all types.
Medical profession, fire department, police department, we all have a common goal. This initiative is so important for our community.
Plus a national firefighter cancer registry and 2 mobile clinics, completing more than 800 physicals in the last 3 years alone. We renew our commitment to emerging new threats through cutting-edge research.
This is a huge wake-up call for us. The quicker that we can identify what we need to handle these types of fires, the quicker we're going to keep our community safe, the quicker we're going to make our firefighters safe.
Expanding our reach across the country with 4 NCI partnerships, while strengthening them at home.
And they're off. Take them away. We're one team, one fight, committing to a world without cancer. It's a celebration of everything that we are and everything that we've done and the potential of what we can be.
Thank you. It's so impactful, and it means a lot to see that the work that we're doing is really making change in the department.
The work that we have been able to do together is the greatest privilege of my career. It's science that translates to action and changes lives.
So on the heels of this video, we began our reflection of the 10 years with where we started. So on your screen, you're seeing some photos back from 2015 with the much younger Dr. Solle and Dr. Kobitz when we started our journey with the FCI, with our firefighters reaching out. On the bottom of your screen, you see our wonderful firefighter colleagues from Palm Beach County Fire Rescue, who till this day remain an ardent supporter and guide in the Firefighter Cancer Initiative. And through a series of ride-alongs, we got to learn a lot about how the fire service works, learn about organizational culture. And that ultimately has fueled the FCI year to year through the research projects that are nominated by our by our firefighter partners, using the science that's available at the Miller School and the Sylvester Comprehensive Cancer Center. So for today's FCR seminar series, we want to reflect back on year 10 specifically. Like, what did we accomplish in this year that would be helpful for us to think about and that could inform where we want to go for year 10. So Dr. Solle and I are going to tag team this effort in sharing you those accomplishments. There are many accomplishments that we won't obviously be able to cover in our webinar today from year 10, but we're highlighting some of the pointed ones that got published so that we can bring those to light. Just to remind you, FCI is currently organized around 6 pillars, and we bring disparate teams across the university and colleagues from other areas in the U.S. to work together in a collaborative fashion with firefighters to address these projects. So one of the pillars of FCI is an epidemiology and cancer registry dedicated to understanding the data, what is the prevalence of cancer, what types of cancers are arising that are unique to the fire service. Our second pillar, led by our biochemistry and molecular biology department, Dr. Sylvia Donner, Dr. Sapnadeo, and Dikichi, is our environmental exposure sampling unit, which we'll talk a little bit about the projects that they've accomplished in year 10. We're going to look at cancer screening, education, and survivorship, led by Dr. Solle, which is an integral part of how we encourage, support, and nurture firefighter groups in engaging in early cancer screening for screenable cancers. And then if they unfortunately get diagnosed with cancer, how do we help them with their diagnosis, treatment, and rehabilitation back into their job as a firefighter? Our fourth pillar is our occupational environmental carcinogen biomonitoring program, as we evaluate biomarkers of effect and biomarkers of exposure in the firefighter corpus. Our fifth pillar is our dedicated firefighter prevention and wellness clinic, which is both available brick and mortar as a traditional clinic for firefighters to visit, but in recent years has been developed as a mobile clinic. We'll talk about the accomplishments of that in year 10, and then the efforts of our leadership pillar. So let's begin. Let's talk a little bit about the cancer registry. So in year 10, the cancer epidemiology surveillance team has really gone busters on a couple of different analyses that they've proposed. In fact, you see that they set out for 8 distinct deliverables to achieve this year on there. And this cohort, this surveillance program in year 10 continues to maintain a lot of different epidemiologic projects. It's not just only our state-based dedicated firefighter cancer registry, which is how in the state of Florida, we're able to develop unique population level estimates of what our firefighter workforce cancers that arise. And this is much in thanks to partnership with our state fire marshal, who our previous fire marshal, Julius Hallis, and our current director, Joanne Rice, have done an amazing job at making sure that our cancer registry team is able to have the resources needed to generate these estimates that are specific to our Florida team. In addition to the registry, these tiles that you see in front of you also represent the various cohorts that we have maintained through the firefighter cancer registry. So we won't have time to show you all the projects, the 8 that they were working on this year in year 10, but I do want to highlight some of the important studies that got published this year through the unique work of the firefighter cancer registry team. So this first study that you see is our multiple primary cancers study, where we're trying to understand what happens with the first cancer that a firefighter develops. Believe it or not, sometimes across all humans, not just firefighters, you may also develop a second or a third cancer in your lifetime. And so we wanted to understand what are those primary cancers or multiple primary cancers that happen. This is a great question to ask of the cancer registry. So through the registry, we're able to link state fire marshal records for who's certified as a firefighter in the state of Florida, and then link it to cancer incidents. As you may know, in the United States, cancer is a reportable disease. So if you get diagnosed with cancer, we report that out to the federal government so that we know at the population level what types of cancers U.S. Americans are diagnosing. So because we have a unique registry dedicated to firefighters, we're now able to identify those specific types of cancers that arise that are there. So the goal was to be able to characterize and document the top 10 multiple primary cancer sites using special statistics to try to get at the numbers. So we had a total of 290,000 multiple primary cancers that arose during the period of 1981 to 2014. And during that time, about 1,054 firefighters were also diagnosed with MPCs. Now, this is very interesting that firefighters in the state of Florida had a 14% higher rate of multiple primary cancers when you compare that to the non-firefighting population, which says that our firefighters are unfortunately at a higher risk for multiple primary cancers. And this was elevated risk for both first and secondary primary cancers of the skin and all types of melanomas. So that was also very interesting. We did not see any signal for other sites such as kidney or lung. So the take-home message from this analysis that the team put into the literature is that this truly reinforces, from a practical perspective, the importance of firefighters engaging in regular skin cancer screening practices and early detection and also about sun protective practices that they can do when they're on duty and off duty, and most importantly, preliminary decontamination procedures. The science is clear that our firefighters are being diagnosed at a higher rate for these multiple primary cancers, and so there's very practical things that we can do to sort of reduce them. A second paper that came out of this program in last year, in the year 10, is a manuscript that's looking at our volunteer firefighters. So I don't know if you all are aware, but volunteer firefighters actually make up the larger bulk of the entire workforce of firefighters in the United States. It's actually around 65%. So the NFPA estimates for us that there's around 1.1 million firefighters in the US, with volunteers making up that 65%. So we were curious about what are the odds of developing cancer between our men and women volunteer firefighters in the state of Florida. So we used a case control study design to evaluate those odds, using, again, the same linkage you saw in the previous analysis of the data from 1981 to 2014 that was complemented by our state fire marshal's records. So what did we find? What did we learn about our volunteer firefighters in the state of Florida? So among male volunteer firefighters, their odds of increasing for prostate cancer are elevated, same as for all male genital cancers. And they had a decreased odds of experiencing endocrine cancers or leukemias with 0.5 of adjusted odd ratios. Now, when we look at our female volunteer firefighters, they were at an increased odds of kidney cancer, almost 2.5 times compared to other matched controls. So the important take-home messages here is that regular consultations with their healthcare providers, looking specifically at prostate and renal cancer, might be a consideration for individuals that are working as volunteer firefighters in the state of Florida, and highlights the importance of routine occupational health assessments. So third and last one that we want to feature for you as a year 10 accomplishment is our personal exposure reporter, which is under the leadership of Dr. Barbara Millay. And this is a free resource that was created and nominated by firefighters, maintained by the FCI. You can access it at per.miami.edu or through Google Play and Apple Store. It gives a personal diary for firefighters to document their individual exposures when they go on scene. So this research team that's part of the Cancer Registry and Epidemiology team published a paper in year 10 documenting the perceptions of cancer risk and gear decontamination among firefighters that are aircraft rescue and firefighting. So as you know, the Firefighter Cancer Initiative is devoted to all types of firefighters, not just structural firefighting. And there's a special place for our airport firefighters who have unique exposures when they're at their airport station across airports all over the United States and here in Florida. So the goal of this particular study, led by Dr. Millay, was to be able to characterize ARF, these aircraft rescue firefighters' perceptions of exposures, their health impacts, decontamination attitudes, and actual cleaning practices. She used a type of study called the Parallel Mixed Methods Convergent Design, where she surveyed 81 airport firefighters and conducted focus groups and interviews with 52 of the ARC firefighters. And what she found is that there's high risk and low decon actually happening with our ARC firefighters consistently, because they perceive cancer risk a little bit differently. 74% of those that she interacted with performed advanced gear cleaning, and 57% tended to do a shower within the hour. There was also some findings around their normative drive behavior, like sort of organizational culture of what they do there. So there are strong station level norms that were classified as primary predictors of decontamination practices, but they did cite through focus groups some resource and time barriers. For example, the lack of having backup gear after they've reported from an incident response, having the right cleaning facilities at the airport station, and sometimes some time constraints can impede their ability to engage in preliminary decontamination procedures. So this allows us to start getting insight into what are some of the occupational safety and health concerns of our airport rescue firefighters. So now I'm going to pivot over to our environmental sampling program by our biochemistry team. So 4 projects were nominated in year 10 to be achieved. And this is a really key and important team for us at the FCI because they primarily focus on designing, deploying, and developing different sampling and monitoring techniques that can be used by our outreach staff to characterize the exposures that firefighters have there, and then be able to look at methods for analysis of both environmental and clinical samples that happen there through unique instrumentation. A very key and important study was published in year 10 through the work of our biochemistry team, which is with our fire investigators. Last year, in year 10, there was a manuscript published on the characterization of the fire investigators' exposure to PAHs, these polyaromatic hydrocarbons, which are normal byproducts of organic combustion. They were measured using silicone-based wristbands. The study was done cross-sectionally, meaning just one time. We asked fire investigators in North Carolina if they would wear these wristbands during unique investigations. These wristbands were coupled with surveys that were asked of the fire investigator before, after their normal routine of doing audits and investigation on scene. The wristbands were quantified using GC and mass spec. And some of the key findings from the study was showing that there was a low molecular weight dominance in the areas where fire investigators were conducting their analysis. Specifically, you found low molecular weight PAHs, which are the smaller sized PAHs that made up about 90% of the load that was seen in all the wristbands that were sampled from these fire investigators, where 47% of them were from naphthalene. And there were some very interesting time correlations between the time of the duration of the investigation, meaning how long the fire investigator took, and the amount of total PAH that was present on the wristband. And it was a positive correlation. So obviously, the longer time the fire investigator spent on scene, there was a moderate correlation with the amount of PAH that was picked up in the wristband. So, this suggests to our fire investigators the importance of really looking at the use of respirators when they're working in an auditing scene to limit any respiratory, and then as well as decon practices while they're doing their auditing. I'm going to pass the baton now over to my colleague, Dr. Natasha Schaefer, who will give you an update on our year 10 key findings for cancer screening education and survivorship. Dr. Schaefer?
Yep, thank you. So as you can see with our cancer screening, education, survivorship, we had several projects underway that we went through. And so if we go to the next slide, I can give you each of our updates. So for our education curriculum, we've actually translated all of our materials as well as our online toolkit into Spanish. So all of these can be downloaded online. And we're also doing all of our curriculum into Spanish as well. And so the reason we did this is not only have other countries reached out, but also Florida firefighters who have been going overseas and to different countries as well to share this information. The other thing we did with our curriculum this year was we enrolled new fire departments in the state of Florida, and we did this with the help of hiring a certified health education specialist. If you guys have not met her, Miss Chelsea Kavanaugh, who is housed in Central Florida in New Smyrna Beach. So it's been really beneficial for our team to really expand our reach and our footprint, not only in the state of Florida, but also nationally, to have our team go out and provide outreach and education and share the curriculum with either new recruits or, current members of your department. We're currently working with Miami-Dade College and their community paramedic program on implementing cancer prevention modules into their training. And so, some departments have really taken in a program of community paramedics. And so we've been working with not only Miami-Dade College on implementing cancer prevention, but also working with other local departments who have a community paramedic program and seeing how we can collaborate. As far as our cancer screening, Dr. Caban mentioned earlier that one of our ongoing cohorts is a cohort of Florida women firefighters. And so through that, we provide HPV self-sampling screening, so screening for cervical cancer. And we're also looking at environmental exposure on our women firefighters, so self-sampling for polycyclic aromatic hydrocarbons, as well as taking blood to look at different markers of fertility, which has been a main concern of our women firefighters. The last thing for our education is our toolkit. So many of you guys are aware of our toolkit. It's an online application that's free. If you go on to your app store and you type in Firefighter Cancer Initiative, you're able to download it. And on there is all of the resources that we've created in our education program. So from the handouts to the videos to our curriculum, it also has clinical information on there as far as what to do at diagnosis. And what we've implemented this year is actually taking that toolkit and creating a physical toolkit. So you can see there a picture of it that has all of these different resources that we've put online now physically in a toolkit. And we've actually identified 10 new fellows nationally that will be helping us implement this throughout the country. So instead of, our team going everywhere in the state and country to share our curriculum, we're actually developing this new program where these fellows had applied, were reviewed by scientists and some of our firefighter colleagues, and 10 were chosen. And so we're really excited to start the training with them, and we'll be doing a peer-to-peer training on cancer prevention. Moving to our survivorship program. So this year we've developed a what to do at diagnosis guide that's pretty comprehensive. Prior to that, we have our cognitive-based stress management intervention, and we are on our 7th group, which has gone extremely well. And so we are at the last stages of that, where we are looking to analyze all of the data and apply for an NIH grant for our survivorship. And so by creating this what to do at diagnosis guide, it allows for a resource for firefighters anywhere in the world that needs these resources, and they don't need to be part of our intervention study. The last thing that's part of our cancer screening is our nutrition study, really coming from our firefighters wanting to know what the nutrition and physical activity status was of incumbent firefighters. So we've assessed over 200 career and volunteer firefighters, as well as provided them with a carotenoid score, which gives them their intake of fruits and vegetables in the last 3 weeks. And so we are moving on to the analysis phase there. Here, I just shared with you some of the things that go into the toolkit, including our screening passport. Again, these things can all be downloaded. Screening passport we have for men and women on the front page. It gives you a background of the types of cancers that firefighters are at increased risk for. It has the reference to IARC monograph. And then on the back, it breaks it up by body system and what the recommended screenings are and at what age. And then in this other picture on the bottom, you can see these are posters that we've created, and then we've created them for to be put up monthly. And each of them have, either on colorectal cancer screening or vaccination and HPV. So really things that you can get online, but also something that would be nice to have in a station that people can see and ask questions about. And that's what our toolkit champions will be helping out with.
All right, so I'm going to take the baton back from Dr. Solle and loop us through the occupational, environmental, and carcinogen biomonitoring program. So in year 10, we set out a lot of projects for our biomonitoring program. We have a total of 12. So here you see 9 of them that leveraged our existing cohorts to evaluate certain biomarkers of effect or of exposure within our firefighters. We had our electric vehicle fire case study that was achieved early on within year 10. And it obviously expanded to different topics, like to look at exposures within our volunteer firefighter workforce. We evaluated high heat exposure on immune system response. Colleagues that are in this program, like Dr. David Lombard, was evaluating cadmium on cancer risk. Maddie Sayre from our team launched the project forward to start characterizing exposures around our wildland firefighters, which is really key to make sure that their data is collected and there. And then with our oncology team are looking at blood samples for clonal hematopoiesis for liquid cancers that can arise in firefighters. So allow me just to share you a really quick update of this accomplishment in year 10. As you all know, we took on back in July of 2024 in true community-based participatory research fashion on the request of our firefighters an electric vehicle study with the goal of trying to understand exposures to battery packs. You know, these battery packs have sort of standard metals that are in them, but the evolution of the battery pack also contributes to differing types of metals, especially at different concentrations that maybe be at different levels in electric vehicle fires when compared to combustion engines. And so our goal was to be able to look at these particular types of fires. So I'm thankful again to various FCI investigators who helped us work with our firefighters in this type of data collection. The goal for this case report was to look at metals, plastics, biomarkers of inflammation, immune system response, PFAS and PAHs. For this study, we set up a Cartesian plane in the north, south, east, west direction to play individual sensors, both passive and active, across the field to measure the plume of smoke, thanks to the leadership of our College of Engineering with Dean Pratim Biswas and now Dr. Shruti Chaudhry, who's still with us and excited we'll continue the work on aerosol science in this space. A lot of data was collected, not just environmentally about what spills out of an electric vehicle fire response, but also clinically. As you know, for this project, we set up a makeshift clinic where we were able to collect various samples from our case study firefighters. We learned a lot. Here's a summary of what we investigated. We looked at particulate distribution within the fields of exposure in that Cartesian plane. We saw that PM2.5 spiked to really high levels following ignition of the fire using propane and extrapolated to really high levels. We saw all 16 EPA priority PAHs there in that background and certainly detected 23 different metals in air samples that were distinct and resolved through characterization of those aerosols. We were also able to study certain physiologic biomarkers in those firefighters. We were able to look at stress and saliva cortisol. We looked at inflammation through salivary CRP collections before and after in the design. We also characterized PFAS levels. We saw that there was a slight increase of PFAS the day before to the day after. Not clear if it's due to new gear that was being used or from on site, but that remains to be discussed and resolved within our group. And then also immune profiling using a very unique 47-plex cytokine panel, thanks to the Department of Pathology, to look at a lot of markers of inflammation, pro and anti-inflammatory, that seem to have different trajectories before, during, and after the electric vehicle fire response. We're also eagerly anticipating the final results from our colleagues at NC State for the effect of gear cleaning on the gear that was utilized during the electric vehicle fire. But also, thanks to the College of Engineering, we're able to characterize the gear off-gassing, what happens in aerosol resuspension during the gear donning and doffing that happens on there. In the same pillar, as I mentioned, we launched in year 10 Project Forward. We actually just closed it, which is a collaboration with the Florida Forestry Service. We began our conversation with them with trying to garner perspective from not only entry-level wildland firefighters, but also their leadership about what are their health and safety concerns. As you all know, in the literature, there's increased attention to wildland smoke, both in the general wildland and wildland urban interface. And we wanted to know how the Firefighter Cancer Initiative can support our Florida Forestry Service. So we enrolled a total of 51 Florida forest investigators. You can see on the left the social demographic characteristics. I want to highlight for you one important, interesting observation that 22% of wildland firefighters have a second job beyond just serving full-time as a wildland firefighter in the state of Florida. And in this sample, the average tenure of working as a wildland firefighter was about 11 and a half years. 4 major themes emerged from this work. We learned, one, that there are challenges and opportunities in how they can voice safety risk and concerns when they're using specialized and specific equipment operations out in the wildland, fire incident response, as well as during prescribed burns. The second theme was how they understand more about their environmental exposures, their chemical, vegetation, and WUI-driven risks. There seems to be a perception that fire that arises from burning a wildland is okay, it's safe fire, as opposed to perhaps wildland that has been pre-treated with insecticides or pesticides. And so sort of helping educate our firefighters about wildland firefighters about those differences seemed to be an opportunity. Theme 3, we found that addressing contamination and cultural norms in the use of PPE and decontamination practices is an issue, meaning what are the best types of gear and use of PPE for wildland firefighters when they are out in the wildland with limited resources for them to use. And the final theme we learn now in year 10 is characterizing the pervasive and enduring health burdens of wildland firefighting. Right? What does it mean long term if you do this as your career could emerge from it? The last and final study I'll share with you that arose from our pillar was the ECHO study. And this is the environmental characterization of health hazards in occupational settings for our volunteer firefighters. So this was a 2-part study trying to evaluate feasibility of shipping wristbands around the country for our volunteer firefighters to work. We work hand in hand with the National Volunteer Fire Council and its Health and Safety Board to be able to identify champions across each state that would help us in engaging volunteer firefighters for the purpose of this study. You can see on the right-hand side some of the descriptive characteristics of the participants. This data is just a little old. It hasn't been updated, but we have 208 volunteer firefighters in this particular sample that were in ECHOs and responded to various fire-related calls or emergency management calls. We took the wristbands that they sent us back and characterized them for PAHs and are learning a lot about what those experiences are, how they're similar to structural firefighting in some instances, and have some unique differences based on the rural context of where they're responding to those different fires. And again, we're thankful to our biochemistry team for their support and help in how we analyze these wristbands for those exposures. And I lied to you, we did another project. As you saw, we were very busy this year on proposing lots of different projects in our biomonitoring pillar. The last one that I will share with you is thermal. Thermal is tracking heat exposure response and markers and adaptive levels of these biomarkers. And the goal was to take better notice of how exposure to high heat environments that a firefighter encounters during training exercises might have an impact on immune system response and inflammation. And so we asked our firefighters that were participating in a standard training exercise if they would wear core body temperature sensors. So you see the sensor there on your right-hand side. It is attached to the firefighter's bare skin on their chest and allows us to collect both surface skin and internal core body temperature. So on the left-hand side, you see the group's average of the sensors that were wore. We received feedback that about 70% of the firefighters in the study said that they were very comfortable to wear, and 90% indicated they would be willing to wear the sensor again. The peak core temperature change rate was moderately correlated with their markers of inflammation. So here's 2 scatter plots to show you on the 2 outcomes that we were interested in. One was inflammation response, and the other one was immune system function. So for immune system function, we were looking at interleukin-6, and the geometric mean of IL-6 decreased initially from about 5.6 down to about 0.7 during the experience. So we collected at 3 time points sample at baseline, 30 minutes after they were in the training exercise, and 60 minutes. And you can see there's within 30 minutes of stepping outside of the training exercise, there was a dampening of interleukin-6, a biomarker of immune system response that was there. And then the other interesting caveat, because we practice public health, is that we asked in the survey, how often do you brush your teeth? Because, good hygiene, if you have poor oral hygiene, you could have high inflammation. And one of the interesting observations here is that firefighters who reported brushing their teeth at least twice daily had lower CRP levels than those who were brushing it once a day. So for our dentists and oral health clinicians that are interested in firefighter health, there is a method to your madness to encourage our firefighters to make sure that they maintain healthy hygiene and keep their inflammation levels down. Our team was also able to score a new FEMA grant this year in year 10 to support our fire investigators. So we will be launching a dedicated national fire investigator cohort. We're wrapping up part 1 of our study, which is focus groups with our fire investigators under the leadership of Dr. Solle, the FLARE study, and then this FEMA grant will continue to inform and develop our cohort study dedicated to our fire investigators. So I'll pass it back to Dr. Solle for our clinic.
Okay, so which goes hand in hand with our cancer screening and education program. We've been really fortunate to receive funding to purchase 2 mobile vehicles. So we've been able to purchase 2 Sprinter vans and turn them into, mobile clinics. And so we have been partnering with local departments and contracting with them to do their annual physicals. And with that, the fire departments then, or the firefighters then have continuity of care and referrals for cancer screenings, as well as any other follow-ups with any other specialists within the UHealth system. If you can go to next slide. So here you can see this is what the inside of the vehicles look like. We've had a great team, with our nurse practitioner, nurse navigator, and our LPN that not only are there for the physicals and the blood draws, but also navigating anyone to care, either for cancer screenings, second opinions, or other specialties. And so in this last year, we've been, very productive in that we completed physicals for 4 departments in the Tri-County area. So we had representation from Dade, Broward, and Palm Beach, completed roughly around 375 physicals. The other thing that we did for screening within our clinical operations is organize a colorectal cancer screening day, where we provided 22 colonoscopies on firefighters all on the same day. And it was really a program that we worked with 1 department on doing. And then in line with our outreach, a big piece of our clinical operations is not only providing clinical care and navigation, but also outreach and educating our firefighters. And so we've been working with local fire departments and their community paramedic program on how to share information on cancer prevention. The last piece is our firefighter nurse navigation program. There you can see our phone number, 305-243-FIRE. We share this and we have, magnets with the phone number that we can share with your departments and you want to keep on the refrigerators, as well as any other resource we have with the clinic. But we share this information because we want firefighters to know that, first responders are considered VIPs at Sylvester Comprehensive Cancer Center. And so anything you need from us, whether it is scheduling a diagnostic screening, whether it's getting a second opinion, we're able to help you with that, with our designated nurse navigator, help you with scheduling, get you in touch with the right site disease group, get you set up, facilitate your appointments, and just overall provide education on cancer treatment and potential side effects of treatment. The other thing is, because we're working directly with firefighters, we are aware of the Florida Cancer Bill, so helping you navigate any of those benefits through your department, who you should talk to within your local, and really answering any questions and being on hand for any guidance that you need. But then once we do the handoff, we hand you off to the nurse navigator for whatever site disease group, and then they take it from there. But it's really that initial getting you set up. But the other thing is, if you are on the call and you're not from Florida and you said, why would I go down to Miami? I live in Georgia, or I live in North Carolina. We are part of, Sylvester is an NCI designated cancer center. And so we are part of this network of other NCI designated cancer centers, which there are only 77 in the US. And so by being part of this network, we have access and connections with other NCI designated cancer centers. So if you are in Ohio, we know providers at the James at, the Ohio State University. If you are in Texas, we know Mays Cancer Center, and we've worked collaboratively with, several of these cancer centers throughout the country. And so it's something that if you were to know somebody who needed treatment, even if they're not coming down to Miami, we're able to provide that care and navigation to them.
Okay, so I'll take, we'll do this last one together, tag team it, but this is our leadership pillar, which focuses on doing different aspects of leadership and support for the Firefighter Cancer Initiative throughout the state. And again, this is without, saying that the support is immense without the team, without our Florida Health and Safety Collaborative. We ventured out to do a lot in year 10, since it's our banner, 10th year, by having the annual 2025 International Fire Service Cancer Symposium. We added to it our Volunteer Firefighter Cancer Symposium, pretended at multiple different scientific venues to share the science that what we're doing here. We visited multiple fire departments and unions to be able to share the lessons learned throughout here, receive feedback from our advisory board, house the Torches fellowship program that Dr. Solle mentioned earlier, and do our outreach, education and resources via social media. So last year was a lot of fun. We partnered with our bureau chief, Charlie Frank, to support our volunteer firefighters in Florida, and hosted a different version of a symposium, much tailored to our volunteer firefighters, which I think was incredibly well received and very useful to learn from their context about how we can help in different resource settings for volunteers. We completed our first year of our Torches program by identifying two firefighters, both a volunteer and a structural firefighter, that completed their deliverables. They now learned how to do human subjects research, got certified in ethics, and launched their own individual programs this year. We also had a really successful 10th year International Firefighter Cancer Symposium. It is a whirlwind of a 10th year. And I know we have a lot of our members of FCI on the call today. Thank you. This could not be done without you. We're incredibly thankful to our firefighter partners, to our legislatures, to our affinity groups, the spouses, to our state fire marshal office. This is truly an endeavor that requires a lot of hands. So you may be wondering, where are we going to next? We were wondering the exact same thing. We're like, okay, what do you do? I think Dr. Solle is ready to retire. Is that right? No, she's laughing. Yes. She's saying no, not yet, not yet. Okay, so we have been diligently working since last semester to identify projects to move the FCI into what would be the next 10 years. So we did an open call to all of our investigators and to new investigators outside of the university. We asked them to please prepare scientific proposals that could be reviewed and evaluated by merit by our advisory board. So we received a total of 31 scientific project proposals, of which 24 of them were brand new projects that did not exist in the previous years of FCI's existence, and 7 that were nominated for continuation. As you can imagine, some of our cohorts and our registry. 20 of these projects are proposing to collect biological samples in different ways. We had about $5.98 million in funding that was requested to do all the scope of work for these projects, and then about 10 different scientists that were selected. And so for year 11, we're looking to increase and further enhance the multidisciplinary nature of collaborations that happen through FCI. We want to build further on our partnerships to create large team science projects that will advance into extramural funding. It is really important that we use the money from the state to make sure that we're bringing additional funding from outside to support the different activities. And so those projects right now are being vetted for merit review and selection. So I encourage you to stay tuned with us, until next month, so you'll learn which new projects were selected to continue to advance them. And so we have just a few minutes left that we'd like to, go ahead and answer some questions from the audience. So let me just open up here our Q&A.
Okay, I can start because I have it open. So it says, is there any effort in state federal cancer registries to link retired or volunteer firefighters who may not know the importance of adding that information to a cancer registry intake?
Yeah, so thank you for that question, Joe. I think we have a memorandum of understanding and a strong relationship with the National Firefighter Registry. Thankfully, the registry maintains and persists. And the NFR is a very important and key resource to understanding cancer incidents. And I think creating awareness of this registry for all firefighters, those with and without cancer, is really key. So as academicians and researchers, one of the things that we do is, collaborate with each other. We tether to each other to do that. So we continue to have conversations as the National Fire Registry evolves, so that we can collaborate on working on the science as well as creating the awareness, which goes to your question about how do we do it. It's really hard to reach all the firefighters. If the fire service had a way, it would certainly make it much easier for all of us, but it requires one-on-one, meeting with fire department leadership and union leadership, volunteer fire service leadership to make these things happen. So yes, that is forefront in our mind to continue those collaborations and bring awareness to these registries. Next question. Could we define volunteer? Okay. So this is sort of like a tricky question. But in general, volunteer firefighters are those that are non-paid individuals that work as a firefighter in their area. So these tend to be firefighters that complete level 1 training, certification as a firefighter. Some even complete level 2, and some even complete additional added qualifications. They tend to be in more rural and remote areas of the United States. Again, they make up a very large percentage, 65. In some geographic areas, these volunteers might get paid a very small stipend, to do some of the functions, but in reality, most of them are just giving their time to give back to their community by volunteering on rescue and fire response in their area. I want to encourage people that are more interested in learning or collaborating with volunteer firefighters to reach out to our advisory board. We have Chief Kevin Quinn and Chief Brian McQueen, who articulate with the National Volunteer Fire Council, and they're a wonderful resource to learn more about volunteer firefighters. Other question? Okay, so.
Okay. Oh, go ahead. I was going to read. So as a firefighter, recording my exposure is a pain. In California, professional firefighters have had access to voluntary PER since the mid to late 80s. It's easier now to report an occupational exposure, but exposure is still underreported industry-wide. The rollout of NERIS, incident reporting platform from the NFA, is an opportunity to collect exposure data at the report level. Any interest in advocating exposure collection there?
Yeah, absolutely. So thank you, Joe. So I think as the fire service continues to modernize its digital platforms of how we keep track of what fire runs you are and what an individual firefighter is exposed to, there is space for many different ways. Our big message that we advocate to firefighters is take personal, a notice of your health and your exposures, and do that however it is. Yes, California does also have a personal exposure record app. We recommend to use it. Folks don't have to necessarily use the FCI's per. It's more about firefighters having a proactive role in doing that. Now, to your question about integrating these firefighters into those systems, that is very much an interest of ours, of how we can partners with NEARS and the NIFR system to be able to do that. Not all fire departments, as you know, probably participate or articulate in that type of reporting. And so, the landscape is very mixed, and we just want to advocate for that, that they are reporting it, because God forbid, if they do develop cancer in the future, at least they have a report that they can document about what their individual exposures are. Okay, our next question is, with your screening program, ultrasound, thyroid, solid organs, and blood vessels as part of your screening process. Oh, it's a question about sort of the ultrasounds.
Yes, so I can take that one. So our mobile clinic and our screening program, we do not use ultrasound. So we do use evidence-based practice, where ultrasound is used as a follow-up for diagnosis, but not for screening. And so we follow ACS guidelines as well as U.S. Preventive Task Force, and also take into account NFPA 1582 recommendations. And so, with that, we do other screenings, through blood testing. However, if there's an abnormality there, then we would order an ultrasound, but we're not doing it as far as screening, only for diagnosis.
Yeah, thank you. Okay, so there's a question from Chief Brooker. Is there a cancer center in Philadelphia? Absolutely, yes, Chief Brooker. There is the Abelman Cancer Center. It's an NCI designated cancer center there. And I'm going to email you after our webinar, because I'm actually presenting to them on the 31st on Thursday in the evening, to share with that cancer center about the Firefighter Cancer Initiative. And I will ask permission if you can be there and listen in, because I think it would be wonderful for you to be there if your time permits, obviously, next Thursday, the 31st. Questions about your geographic area and cancer and firefighters, like Dr. Solle said, we have a rich network of connections with the other NCI designated cancer centers, which have a very high standard for cancer care. So I encourage you to reach out to Dr. Solle. She can help with the navigation to the appropriate one.
Yep. And then I see another one from Shine Chang. I love your torches program. Are you able to take more than 3 people each year? Would there be interest among firefighters to train larger numbers each year? So yes, and so this was the feedback that we got, really overwhelming feedback that we got related to the Torches Fellows, because more people wanted to be involved. And so that's what I was sharing about the Toolkit Fellows. So we put out an open application a few months back, and they just received their awards that they have been accepted. And so what we've done, instead of doing 2 fellows that each do their own research project, we've opened up to now 10 fellows, and it's the Toolkit Fellows, and they will all be working on the same project, which is an already established FCI project, which is our cancer curriculum, cancer prevention curriculum. So that's how we've been able to increase our number and really get a broad range of firefighters involved in research. So they will still get the same training that our Torches Fellows did, learning about data collection, doing their city certification, what it takes to enroll participants, how to collect data. And then they will all be stewards of research, and will be collecting data and presenting the FCI curriculum. So that's how we have done that. And so our plan is to continue that on a yearly basis, as long as, things continue to go in such a positive way.
Yeah, and we're just at time. So I apologize. I will have to close out our webinar series. Again, I just want to, on behalf of our, Dr. Kobitz and our team, thank you. We hope that these seminars continue to be informative and useful to our firefighters and to our peer scientists. We look forward to seeing you next month as we continue our first scientific seminar. It won't be a recap, but what projects are advancing forward into year 11. We wish you all a good week. Bye.
Bye, everyone.